All right, so this is the premium dental associate production calculator. So this is one of the aspects or one of the calculators that would be included in your purchase. So why I made this, I want to be able to start with the end in mind. So every month I wanted to know what is actually going to hit my bank account, not what I'm going to be paid before taxes, because that really doesn't matter. We're dentists and we get taxed a lot. I want to know what hits your monthly take home. What's your monthly take home after taxes and after all your production. So this is where it starts here. This is your monthly take home goal. Let's say, for example, you want to have $13,000 hit your bank account every single month. So you can change this. You can move up and down. If you're let's say you want a really great month and you're looking for 15,000, just for example. So you put that in before you start. You should always go to this contract and state details here, and then you can see that you can change your actual contract details. So personally, 35% production is what I have in here, and then you can do the state filing status and Wisconsin or married and whatever. Every state's in there. All very, very accurate tax information. A lot of data crunching, but it should be very accurate, and I'll send some tips and tricks to even make it perfect accurately if you decide to purchase. So what then you can do, the next step is you go to this page, which is the days working this month, and instead of going to the calendar, counting how many days you're going to work, it's as easy as just checking or unchecking a box here. So for example, in July, you're not going to work July 4th. Let's say you don't work on Fridays. You can change that. So you're not going to work a few Fridays. Let's say you take a random Monday off here for a doctor's appointment. And then based on this goal, which again you set here, you can then see what you need to be paid what you need to produce, every single day based on this goal. So it will give you the daily average net production that you need, and then it'll do the cumulative. So it'll add it for you, and then what is simple enough is that it highlights the day. It will automatically highlight the day for you, and then it also pulls that data and puts it right here. Something I use hourly, basically after every patient, because I like to track on kind of how I'm doing, is this box right here. In this box, you can enter your current adjusted production. So let's say you just did a little occlusal restoration and you made another $250 or whatever it may be. So you can put that in there, and then you get this data. So you can see your percent to goal and then percent of the month worked. So you can see how it's tracking. I'm a little behind my schedule here. But then you can also see the net income to date right here. So this is cumulative. This is calculated by the number of days worked. This will automatically pull as well. So very simple but useful tool. I optimize it for as easiest use as possible. Once it turns to August, you'll be able to change this here and then select the days you may or may not be working. Just an example, let's say you're trying to decide, should I work every other Friday? Should I pick up an extra day of working? So you can just add this here and then see how it reflects your daily net production and your cumulative net production there. So simple tool. Now, in addition to this, what's also very helpful, maybe not as used as frequently depending on how many kids you see, but pediatric anesthesia calculator. So what was always annoying is that all these anesthesia calculations they're in weight, and for the most part we don't really take weights on kids if you're not doing a lot of work. But just to be on the safe side, you still want to make sure that you're staying under the recommendations and all the guidelines set by the AAPD. Most of the time we don't even get close to these maximum doses of anesthetic, but still. So what's easier here, so I pulled all the data on the average weight of every single month for a child. I think up to age 20 is what I pulled. The average weight for every single month, and male and female. So what you can do now, let's say you have a patient coming in for a stainless steel crown, and you can enter that they were born November 10th, 2020. Based on their weight, which again, this is pulling from the average weight of a male that was born November 10th, 2020, it will calculate automatically at the maximum dose. Now, again, this is average, so there's going to be outliers, but it at least gives you some sort of outline here where you know general guidelines about what you're approaching. It'll also give you a few warnings, like let's say if you try giving Articaine to a younger kid, it'll give you a warning. So again, I pulled all this from the AAPD. This is all literature backed. I can show you the calculations as well. But in any case, a nice little tool. I have a couple other calculators in works, an oral pathology one, and a don't perf that tooth with some literature backed dashboards that you can use that I will also send you if you decide to purchase this bundle here. If there's any questions, let me know. Hopefully this is helpful and gives you some more insight on what's actually going to hit your bank account.